next. My feet are killing me. You've heard of Dr. Pimple Popper. Many people love her graphic but satisfying pops. But did you know that every day similar medical transformations are happening on people's feet? Whether you have an extra toe or your feet aren't the same size, TLC is tackling it all.
I don't think I've seen the most shocking thing yet, but I have seen a lot. We have to kind of think on our feet, so to speak. There are always things that are going to pop up. The fact that we can stomach a lot of things that other people probably couldn't or wouldn't, I think that's a good thing.
If your base is not right, it affects everything else up. Your knees, your hips, your back, your shoulders, everything can get affected if you don't have a steady foundation. So, I mean, a lot of things that are wrong with you can be manifested in the feet. So.
Up next, the craziest feet videos that you can't unsee. We've got a power team of podiatrists from the hit show My Feet Are Killing Me.
We can't wait to get our hands on your feet, Dr. Oz.
My feet?
Yeah.
Don't be shy.
Stay tuned.
No way.
Oh, I know who it is. Oh, wow.
So to answer that question, get ready for our expert, okay? She's known as America's podiatrist. She has a private practice in Southern California. Oh. And according to her hit reality TV show, she has never met a foot too funky to fix. Please welcome Dr. Ebonie Vincent. She is the host of the...
Oh, my gosh.
Host of the TLC hit reality show, My Feet Are Killing Me.
We spoke to podiatrist Dr. Ebonie Vincent to find out the truth.
1, 2, 3, 4, 5, but it's this part of my foot.
She does not have a sixth toe. She has an adventitial bursitis, and it's probably as a result of high friction and wearing high heels a lot.
Podiatric medicine, live virtual white coat ceremony. I'm Dr. Eric Stamps, and I'm honored to serve as Dean of the California School of Podiatric Medicine and presiding officer of this milestone event, which I now declare open. It's now my honor to introduce our keynote speaker, Dr. Ebonie Vincent. Dr. Vincent is a graduate of the College of Podiatric Medicine and Surgery at Des Moines University in Des Moines, Iowa, and she completed her surgical residency in Spira Health Network in Vineland, New Jersey. Dr. Vincent practices in Orange County, California, and has become well known in both the podiatric community and in the community at large as co-star of the hit TLC reality television series, My Feet Are Killing Me. She was asked to be our keynote speaker as she is both a successful young podiatric physician and a great role model for future podiatrists. We're fortunate that Dr. Vincent was able to clear her busy schedule to be with us this evening. Dr. Vincent.
Well, hello and good evening, and thank you very much for having me. And what an exciting moment. I'm very excited and humbled to speak with you all today on such an important day, your white coat ceremony. Undoubtedly, this is the beginning ceremonial day that marks the beginnings of your journeys to becoming the next generation of podiatric medical physicians. It's a coveted profession that will play an important role in the lives of your future patients. This day marks the beginning of a journey of a new chapter that you have worked so hard to get to. Your past works, trials and tribulations, late night studying, test taking, and degree earnings have brought you to this date and to this time. It's my hope that I play a role as your speaker today to impart knowledge of what I've learned so far in my journey and to embed some pearls of wisdom that I hope you will channel as you continue through podiatry school, residency, and eventually your respective practices. Admittedly, however, you should know that I was very distracted during my own white coat ceremony. The day prior to my white coat ceremony, we had just taken a biochemistry exam, and I was very anxious, just hoping that I had passed the exam. And I was so nervous that the faculty was going to pull my white coat from the pile and that I had failed the test. But thankfully, that didn't happen because I am here today, and all went well. And I went on to accomplish things that I never really even dreamed of. So I tell you this because I challenge you all to pause any anxious thoughts in your head, open your minds, and listen and contemplate on today. Today, I'd like to speak to you all about what I perceive is the most important quality that will make you the best doctor you can possibly be. I'd like to speak to you all today on the topic of introspection. By definition, introspection means the examination of one's own conscious thoughts and feelings. In psychology, the process of introspection relies on the observation of one's mental state, while in a spiritual context, it may refer to the examination of one's soul. In the field of medicine, we have a very regimented task set: 4 years of college, 4 years of medical school, 3 years of residency, a fellowship program if you choose to do one, and then finally a fully practicing physician. More than 11 years of molding and modeling yourself to become a fully trained, competent medical professional in the sciences. A doctor of podiatric medicine. That is our goal. Putting on that white coat symbolizes, without uttering one word, that you are trained, skilled, competent, and have run the race of completing and accomplishing this goal. But what symbol is there to demonstrate those intangible traits that truly make up the fiber of being a good doctor, a great doctor? What is the symbol that states that one is empathetic, understanding, a good listener, an educator, one who demonstrates patience in difficult discussions? What training do we seek in order to fully dedicate ourselves to the art of medicine, the actual craft of relating to your patients to develop trust, rapport, and relationship with your patients? I would argue that the white coat can and should embody all of these attributes and more. It has been my experience that developing your interpersonal skills, allowing yourself the opportunity for introspection, to be able to recognize your own conscious thoughts that have been learned and influenced through your experience as a student, and allow yourself to empathize and listen to your patients. Learn from past experiences and grow and build on how you can continuously transform yourself into being the best physician that you can be. This is a task that has proven to be difficult for even the best of physicians. With all of the education that you will receive, the test you will take, the biggest lesson that you'll come to understand is the fact that the answer to your patient's problems are not on multiple choice. It takes a deeper amount of not only book knowledge, but emotional intelligence to navigate the doctor-patient relationship in order to reach to a point of healing. As you place your left arm through your white coat, know that you are representing compassion, empathy, listening skills, and hope. And as you place your white coat on your shoulders, accept the responsibility of being a healer, a champion for each and every patient that you encounter, an ambassador for financial equality, religious equality, sexual orientation, and racial equality. Treat all individuals with your brain and your heart. Lead with love and continue to learn and grow. Wear your white coat proudly, and congratulations to all of you today. Thank you.
Well, Dr. Vincent, thank you very much. That was excellent.